This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 10 of a 58-part series on the entire book. We recommend that you review the introduction video, which will give you the background. It is important to consider the very next supplement as truly critical for heart failure treatment. In Japan, 10% of the entire population is taking CoQ10, that is coenzyme Q10, for treatment of heart failure. This value is 1, which means it is critical to recovery, vital that you take enough CoQ10. And when I say enough, the majority of persons taking it, even if they take it for heart disease or heart failure, they generally do not take enough. CoQ10 is a demand enzyme, the most important enzyme for creating energy in human body cells by ATP transfer. Your heart consumes over 25% of all the ATP your body consumes per day. That can be 6,000 grams of ATP per day, or over 13 pounds, recycled through heart cells every day. If you have heart failure, you definitely have a serious shortage of CoQ10. Heart biopsies often show a 75% rate of deficiency. As soon as you finish reading the chapter on this section, or listening to this video, you should take 100 milligrams of CoQ10 hydrosoluble version. That is a Q-Sorb or Q-Gel or Adsorb. These are the 3 trademark names. If you do not have some with you in your home, go out and buy some. Order some. Over 1,000 persons with heart failure die each day, and CoQ10 is the critical enzyme. CoQ10 was developed in production form in Japan during the 1970s. By 1976, CoQ10 was added to the hospital formulary as a Class D medicine, a prescription medicine in Japan. And the English scientist Peter Mitchell developed an explanation for how it works and was awarded the Nobel Prize in 1978. Clinical studies on CoQ10 with heart failure patients are very, very dramatic. In one study in 1990, 137 patients treated with CoQ10 for 46 months, the survival rate increased 300%. The dose was 33.3 milligrams 3 times each day, or just 100 milligrams total per day. The placebo group had a survival rate of 25%, or 1 in 4. The CoQ10 had a survival rate of 75%, or 3 in 4 among those with even weaker hearts than the placebo group. There is not anything more I can say. If you want to live and continue living, taking enough CoQ10 is critical. Now, the charts in this book list varying amounts of CoQ10 based on body weight. So if you weigh between 170 and 250 pounds, it is recommended that you take 100 milligrams per meal, that is 3 times per day, in the first week. In the second week, 200 milligrams per meal, 3 times per day. In the third week, 300 milligrams per meal, 3 times per day. In the fourth week, back off to 200 milligrams per meal, 3 times per day. The purpose of this protocol is to determine what your body requires for strength in your heart muscle. How much energy do you need from CoQ10? Now in Japan, I mentioned 10% of the population is taking it, and that's 12 million and climbing. So it is quite important that you measure off how much your heart and your body demands. That fourth week, when you cut back, try to remember how you felt in the third week, strength-wise, when you went out and walked and bicycled and exercised. If in the 4th week, with a reduced amount, you feel weaker, if you feel sort of a nagging sense in the center of your body that you're not as strong, then you need to take more. If you feel perfectly fine after backing off, then you do not need to take more. It's all a question of how much you individually need. This is what is unique about this book compared to any other medical self-help book covering the subject of CoQ10, is that most heart failure and heart disease subjects, persons, do not take enough. They do not treat it as a medicine, which it truly is. CoQ10 dosages depend upon how much you personally need, so adjust accordingly. If in the future you feel a little weaker and you increase your dosage and feel stronger, you can test back and forth and see how much you absolutely need to take at a minimum. Keep in mind that if you're taking statin drugs to remove or reduce cholesterol levels, that is cholesterol components, not true cholesterol, you will need to take more. In Canada, the medical establishment requires a black box warning label. This is the government requires a warning label that CoQ10 therapy must be applied to replace all that the statin medications have destroyed. Even Merck & Company issued a patent number from the U.S. government, included the requirement for CoQ10 with their statin medication to replace what was lost. When I began CoQ10 treatment in 2006, I was very weak. I knew my chance for survival, even 12 weeks, was not very good. I researched what was the maximum anyone had ever taken, and I began with 200 milligrams per meal, or 600 milligrams per day. At that time, it was considered a very high dose. My energy level rose significantly, and I got up to 10 miles a day, eventually 15 miles a day bicycling. I traveled to Hong Kong and conducted normal business work. After 6 months, I overheard a broadcast announcing that heart failure patients who stopped taking CoQ10 suffered a relapse. It was at that point I realized my entire survival depended upon taking enough. So, on a hunch, I doubled my dosage to 400 milligrams per meal. I was taking the powder version, hydroquinone, rather than the new hydrosoluble versions that are now available. And so therefore, at 1,200 milligrams per meal, I was probably absorbing only 10 or 20% because it's a fat-soluble powder. My energy level doubled. That's right. I doubled the CoQ10. My energy power level doubled. Just overnight. A few weeks later, I made a 32-mile cross-county bicycle ride. No strain. Just didn't race, but I took it steady. And I realized that CoQ10 was vital to my survival. One day, I had not been monitoring the quantity I had in my storage cabinet, and when I checked, I found I was running out. I cut back the dosage in half until a new order could arrive, and my energy level dropped in half. This is before I was totally restored with the final enzyme package. So it's very apparent, take enough CoQ10. There was a clinical test to see if you could take too much. They actually tested extremely high doses of 1,200 milligrams to 2,000 milligrams per kilogram of body weight. This works out to about 65,000 milligrams to 92,000 milligrams per day for a human. A dose no human would ever take, and it was completely safe. Lower blood pressure, that is reduced hypertension, is also a side effect of CoQ10, as well as some other interesting side effects, such as the gums around your teeth will improve. CoQ10 reduces heart arrhythmias, heart palpitations. In one 28-day clinical study, this reduced anywhere from 9.5% of arrhythmias from the placebo group, which suffered from 25.3%. So it was a significant reduction. That was just a minor dosage of 120 milligrams per day. In summary, think of CoQ10 as heart energy food. Take enough to feel normal and healthy. Treat it as professional medicine. There is no pharmaceutical with the power to restore energy to the heart anywhere near like CoQ10. My name is J. Randall Wilkerson. I am the author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available on Amazon, both in print and Kindle edition, at the Apple iTunes Store as an iBooks, and on eBay as a print edition. You can also order it from the publisher Wilkerson & Hughes at P.O. Box 777, Altoona, Florida 32702. Just send a check for $24, which includes shipping. Thank you for listening.